Good afternoon, everyone. Thank you so much for joining us today. We're so excited to have Dr. Bianca Merritt engage with us as we continue our celebration of the life and legacy of the Reverend Dr. Martin Luther King Jr. My name is Sherry Notaro, and I'm the Director of Diversity, Equity, and Inclusion at the Institute for Social Research at the University of Michigan. And I will be the host of today's webinar. So I have just a few housekeeping features for you. First of all, I want to thank our communications team and our MLK Planning Committee for all of their help in the planning and execution of our MLK events. Now, today's webinar is being live captioned. So in order to enable that feature, just at the bottom of your screen, if you could turn on the live transcript CC button, then you'll be able to see the captions. After Dr. Merritt's presentation, we will be able to send you a link of her presentation. And right after her presentation with us today, she's going to talk with us for quite a while. And then when she's finished with that, we are going to go to the Q&A portion of our event. And in order to submit Q&A, if you could just use the Q&A feature at the bottom of your screen, you can submit a question and she will be able to curate those and answer some of them right after her presentation. So now I want to formally introduce Dr. Merritt. On January 4th, 2021, the Indiana Family and Social Services Administration welcomed Dr. Bianca Merritt as the agency's first Chief Health Equity and ADA Officer. In her role, Dr. Merritt will provide leadership in the evaluation of policy decisions that affect race equity. She will build metrics for agency accountability, ensure agency adherence to the Americans with Disabilities Act, and build a culture of equity across the agency. Dr. Merritt is also a diversity scholar at the University of Michigan and founding director of the Center for Research on Inclusion and Social Policy, or CRISP, at Indiana University, Purdue University, Indianapolis. She will maintain a faculty research position with Indiana University and continue to publish research about complex social issues and inequitable outcomes. Dr. Merritt earned a bachelor's degree from the University of Oklahoma Gaylord College of Journalism before a master's degree in political science from Texas A&M University. She then earned a PhD in health promotion sciences from the University of Oklahoma's Hudson College of Public Health with a specialty in health disparities. Welcome, Dr. Merritt.
Thank you so much, Sherry, for that wonderful introduction. And I'm really grateful to be here, grateful to her and her team at the University of Michigan, and to be a diversity scholar as a part of their work as well. So the opportunity to present is very much appreciated. And I'm so glad all of you could join us today. So thanks again for the opportunity. I'll be sharing my screen with you all. So again, thank you for the opportunity to speak about the role of community engaged research and how that might interact with Dr. Martin Luther King's legacy. So the idea of research and Martin Luther King doesn't always come up. So the idea that we could merge those together in this presentation is something that I was really looking forward to and hope that you all will take away from this work. So I wanted to start off with an image that I know many of you are very familiar with. This took place, of course, during the summer, where we saw a large number of social justice and racial justice related protests related to the killing of George Floyd, and of course, bringing up and resonating the numerous numbers of Black individuals in particular who have been killed by police over the past several years, and particularly this year. And so this was not just a touch point for people socially. I've personally been very surprised at the level of engagement and interest that non-Black folks have had in the role of racial justice, what systemic racism is, what institutional racism is. But I think one of the more interesting developments over the summer was the role of my own fields of research, which would be public policy, public administration, and public health. And the abject shock at the fact that these weren't really topics that our field had dealt with in a way that was catering to the current discussion and discourse around racial justice. So we're throwing around these terms like systemic racism, institutional racism, and those necessarily involve systems and institutions who studies those? Scholars of government, policy, politics, et cetera. And the lack of research that had been done in the space was pretty glaring. And it was really a call to action for a lot of colleagues who either had done this work and not gotten the attention they required, or who had not even thought about this. And so as a result, I think that really showed me that a lot of things were missed, particularly in my disciplines, because we did not do enough community engagement for the years and decades leading up to these very public events. And so my presentation today is going to really talk about what community engaged research is. And I want to break this down into 4 different areas for you: that it is a form of protest, that it is a community resource, that it is a recruitment tool, and that it is research. And hopefully by the end of that, you will understand why I added research at the end of this. So I thought it would be important to start off with a little bit about my story and background and how I came into this space, which of course is not new, it's been around for a while, but I think my experiences and path are probably relatively similar to folks who kind of end up doing community engaged work. So I showed this slide to you earlier, again, thinking about these protests, and what it did is it also harkened back to a different time in our society. A lot of comparisons were made about how was just a continuation of civil rights related protests taking place in the 60s. And so myself, as a native of the South and growing up around my elders and other folks in my family, grew up asking and observing a lot of things that didn't really connect with what I was learning in the classroom. I was really passionate about issues of racial and social equity from an early age, but didn't really have the language or the tools to talk about that. And so I was always really confused about, I like government, I like policy, I think it's very important. I also think racial equity is very important without having those words, but didn't really know what that looked like in terms of a career or even other types of supportive activities. So as an example of some things that I heard and had to kind of reconcile growing up were things like how the government and HUD, enabled my family to live in housing projects, my grandparents, but it was built on top of a former chemical plant. So they're inhaling all these toxins and carcinogens, even though they were given an opportunity to live, quote unquote, a better life. I had another set of grandparents who also had the chance to not just build a home, but custom design it, even though their house is right up against a federal interstate highway, and their neighborhood is bordered by an airport and an oil refinery. So again, figuring out how those opportunities lead to other problems. Hearing stories from my parents and others about how this opportunity to racially integrate in schools was really billed as this really wonderful chance for Black students, but then also hearing about the long-term psychological traumas that came out of having to go through those experiences. And then lastly, and probably a story for another day, but how my grandfather went to moving from this culture of not having a lot of racial justice protests back then, civil rights protests, the cities using other types of opportunities and career advancement to prevent that from happening locally, which led to my grandfather actually becoming one of the first Black police officers in our hometown, then also being arrested for police brutality. So I'm seeing and hearing all these stories and trying to figure out how can we do something from a government perspective to kind of alleviate these issues. And so I did this in a few ways. I started off, as Sherry very nicely outlined, with a career in journalism. I thought storytelling and telling compelling stories about people's experiences to me was the way to draw people in to why racial and social equity was so critical. But I also felt limited in that stories were important, but that I needed additional evidence, not just interviews, ad hoc quotes. I needed something more robust. And so that led me to pursue work in political science and public administration, where I can learn more about systems, organizations that are publicly funded, knowing the role that it had on my family's life and being led to figure out, well, how does that work? Digging into statistics, figuring out the nitty-gritty of what it meant to be a traditional academic researcher. But I figured out that that really wasn't a great fit for me. I actually went around kind of assuming that everyone was getting a PhD because they wanted to make a difference in the world like I did. And that was just not the case, and that's okay, but I had to reconcile if that was the greatest fit for me. So despite, at that point, years of doctoral training, I actually switched over to public health. And for me, it was an opportunity to marry both these mixed methods, using that storytelling technique from a qualitative perspective, bring in statistics and policy analysis, and then also being able to do that in a way that was community engaged. And I didn't quite have the language for that then, but I understood that there was a need I was working at the time for a few years with rural Native American communities in Oklahoma. And so having the ability to directly see how your research findings can influence people and how they can influence your work was an incredible experience for me to understand what a career could look like here. So I like to think of this as the road less traveled. For those of you who might come from a STEM background, you might figure out pretty early on, you don't want to be a physician, but you really like this biochemistry stuff. And there's definitely a pretty clear path for you. You might not know everything, but that's a really well-trodden path. I think those of us who are more in the social sciences space, you're not 6 years old talking about, I want to be a sociologist. It's something you kind of grow into. And your path is a little more winding. You'll get there eventually, but you figure out kind of where you fit and how that works out for research. For me, unfortunately, or fortunately, and I think for some other folks as well, I think of this as kind of a forest, a wilderness, figuring out something that a lot of people aren't trained to do consistently, and where there's not really a place directly for you to go all the time or a resource to use where you can figure out, how do I marry again? How do I come up with these normative questions with real world implications in the social sciences that's also true to traditional research methodologies that also, again, can kind of have an impact. And so this is definitely a road less traveled, but also, I think it means there's a lot of opportunity in this space for all of us. And so just as a refresher or a primer for some of you who aren't aware of what community engaged research is, this is the textbook definition, that it's about working with different groups of people, usually united by geography and special interests, so that they can address issues related to their well-being. Of course, the research part is, someone at a university or some other institution, but of course, implying that community is a key part of that. And so some key tenets of community engaged research, again, this is kind of an ethos and a practice and not necessarily, a specific way of doing something. One key tenet, though, is bidirectional partnerships. So building community trust, that you're not just plopping in there to find some people. We're hearing a lot with the vaccination process about, the Tuskegee experiments and some, work that Johns Hopkins had done previously, and how that created a lot of distrust among Black communities. But so that's not what you want to do. Community engaged research is about truly developing relationships with organizations, community residents, so that they can come to you, but you can also come to them. The definition also alludes to geography. So the idea is that you're really focusing on key communities, neighborhoods, cities, regions, et cetera, to really have the greatest amount of impact in that space. That it's multi-method, meaning that if you have a research methodology that you like or that you're great at, welcome, you're a community engaged researcher. You can do pretty much any methodology as long as it fits the needs of the geography and the partnership that is taking place. And lastly, that it's multidisciplinary, that it's usually something that's going to require a variety of different knowledge bases and experiences to make this type of research effective and usable. So one of my colleagues at IUPUI, Sylvia Garcia, developed a bit of a framework for how we can consider that, because you might be looking at my definition and say, oh, I don't do that, or I don't want to do that. But I want to argue that I think a lot of us do community engaged research without maybe fully knowing what that is. And so she came up with a matrix that tells us on the horizontal axis that tells us what the role is of community in our research. Do we view them as someone who's actively engaging with us as a participant, or do we view it as an opportunity to have the community as more of an object of our research? The vertical axis is about what we plan to do with the results when they're done. So we can use that to uncover knowledge and potential with the community, or we can use it to create solutions that more directly impact those communities. So in our first quadrant, this talks about emphasizing information exchange and production of usable knowledge. So in this case, you're coming up with research that is going to support the community using their own ideas, but also that your goal is to provide something that's a little more of an exchange and less of kind of a final product. In this quadrant, where many of you might be, it's more about the knowledge validation and creation of solutions. So you might have a theoretical construct, or again, you're seeing something maybe related to COVID, and you want to see what that looks like in a particular community. So you're going out, you might have some loose relationships with partners or agencies to figure that out, looking at coroner data, for example, and then coming up with an analysis that says, here's what we're seeing in this space. This quadrant, which is where I eventually grew to see myself, is an emphasis on interaction and user-centered solutions, meaning that I like working with community, residents, organizations, but I like being very practical when it comes to policy solutions and direct information they can use for improving and guiding their decisions. And the last quadrant is about emphasizing participation in social transformation. For those of you who might be familiar with the idea of community-based participatory research, this is usually where that falls, where we're really trying to learn as much as we can from community residents and organizations, but we're letting them guide us. We're really giving a lot more deference to community, whereas on the bottom side, we're still kind of having some agency as researchers, whereas the top, we're kind of letting go quite a bit in that quadrant. It's really releasing quite a bit there. And so this is the wide range of ways that we can conceptualize community engaged research, and that has certainly influenced how I do my work as well. So when I talk about community engaged research as protest, I want to reiterate these key points: that one, when you are engaging communities, it challenges the status quo, especially for traditional academic research. The reason why is because it, for one, existing is a statement. If you are saying that you are going to do this type of work, and especially if you're trying to challenge norms of equity, is a statement to academia saying that we're going to overturn something simply by just doing this work and pursuing it. Saying that community residents are experts is a form of elevating the oppressed. And it challenges the status quo as well for communities, for them to be able to see that research can be beneficial to them if this work is done correctly. And the reason why I want to reiterate that community engaged research is a form of protest is that we've had a lot of students and other colleagues who, they maybe didn't want to march, or maybe didn't feel like that's where their talents are. And I want to remind everyone, especially if you do research, that where your position is where your gifts and your abilities are. And so for a lot of us who do things in research, I don't think it's good for people to feel deterred about what their role is in Dr. King's vision. We all have a role to play, and research is certainly, and equitable research is a key part of that. So I want to shift now to community engaged research as a community resource. And so I want to talk a little bit about the Center for Research on Inclusion and Social Policy, also known as CRISP, which is what I founded at Indiana University and Indiana University, Purdue University, Indianapolis. And this was quite a process. So I kind of looked you guys off, that I was interested in doing some work in policy and, social equity, and not really knowing what that looked like. There weren't really positions like that. I was really convinced that I wanted to work for a government agency, but coming out of grad school, one thing I didn't mention is throughout my entire time pursuing a PhD, I was really clear that I did not want to be an academic. I mean, I could tell you repeatedly that's never something that I wanted to do. And then I get out of grad school, what do? I take a position at an academic institution. It was a non-tenure track position, but that really allowed me the flexibility to do what I wanted to do, which is what I wanted in that type of role. So I worked as an analyst at the Indiana University Public Policy Institute, which is part of the School of Public and Environmental Affairs at Indiana University. And so the premise of the Institute is that they provide, research that's relevant to the state of Indiana and related communities to provide information for them to make decisions and to keep them engaged. So the general premise of the Institute is something that I can definitely buy into, but because I'm still kind of, a classically trained researcher, I still wanted to pursue these issues of equity and inequity. And I wasn't really sure how to do that because at the time, about 2015, 2016, there really wasn't a lot of talk about what that looked like, and especially locally. For those of you who don't know Indiana, as I often like to say, the birthplace of the resurgence of the KKK, this is not a state that is super open and inclusive, but even in the city of Indianapolis, which is pretty progressive, I think, in terms of those issues, there were still, language choices and things that, might have made folks uncomfortable in this space. And a lot of people, even those who were doing research loosely in this area, just weren't comfortable talking about in a public and community perspective. And so the way that this is structured is that within the Institute, they had multiple centers, and I pursued the idea of creating a center within the existing institute to, again, provide that flexibility, but also existing stability of a research entity. So have this idea. I think inclusion and equity is incredibly crucial, regardless of what people are saying. And I'll say, going back to this, the reason why we knew that this was an issue is not just because of my research interests, but because of what community residents were telling us. And so hearing from them firsthand about their own experiences with inequity, and not just as regards to race, but across a number of communities, really reiterated the need for this work. But then how do you fund it? Usually, as a lot of you know, research centers are funded through federal or large grants. An institution will give you some sort of support, or, which is also pretty common, at least our institution, where folks might have some individual research that they are like, yeah, I'm going to create a center, and it's, you know, that person and the grad student. And we had none of those. We did not have a lot of external support coming in a more traditional fashion. And so we actually built off of what we were already doing, which is community partnerships. And so what we did here, and I don't think this is totally uncommon, is we'd already developed a number of partnerships with community organizations, state and local agencies, and they were already working with us to get funding through partners, or we were working with partners to get different levels of funding. So they were already, you know, applying for a federal grant, they need an evaluator or researcher, and so they reach out to us. Our emphasis initially in developing this was on social policy, because again, that was the work that we were in, looking at social service provision. And it's something, of course, that I have training in as well, in terms of public organizations. And so that was fine. A lot of the funding at the time in Indianapolis really focused on poverty reduction and social service provision. So it was in perfect alignment. But again, there's still this issue of what about equity, and how do we elevate that discussion, even though our partners, our formal, you know, organizational or agency partners weren't ready to have conversations about what racial or social equity looked like locally. And so the center was developed, and what you're seeing here is actually something that was created by our graphic designer and research coordinator, special projects coordinator, to conceptualize to people who did not care about issues of race or equity about what we do. So we had to make this argument around, we do social policy, which is social service, public safety, education, all kinds of issues, housing, and that those factors are complicated by issues of race, gender, ethnicity, class, et cetera. And so making the argument that you need this center because we're the only ones talking about issues of equity, and the fact that it intersects with all these social issues that are so critical to our quality of life. And so that is how the center came about, and that is how we have to kind of tweak it. You notice that the I stands for inclusion rather than inequity, because there's also a lot of discourse around, well, the word inequity might make people mad in Indiana because they don't want to feel like they are doing something wrong. So we have to use the word inclusion, which is still kind of buzzy, but also to really get buy-in, because otherwise folks weren't going to really support some of our work in some ways. So our mission at CRISP is fourfold. Our first is to evaluate solutions. We do this by supporting organizations to improve their outcomes and reduce disparities, especially through ongoing and future evaluations. Developing knowledge that includes addressing complex social issues by doing exploratory research. We really like to do work, obviously, on how we reduce disparity, but also, of course, how that intersects with social policy, as the diagram showed. Disseminating information. This is a key tenet of our work because it's about informing people about what we're finding, doing this through reports, blogs, a lot of community presentations, and getting our work out there and beyond just kind of a printed space, and really going into community and into media outlets and making sure that people understand what we're finding. And then lastly, developing future problem solvers. We believe in engaging students in applied research opportunities and providing them with training on a host of issues, including research, but also because we do community engaged and applied work, it's so critical to build things like leadership skills, professional development, as well as what it means to meaningfully engage in community, as well as legislative decisions and other structures that they might not get in a typical research setting. So continuing, CRISP is structured with a few main components, primarily analysts, a director of evaluation, program analysts, and a special projects coordinator who handles any kind of media related issues and outputs from CRISP. Students, as I alluded to, are a key component of our work, research assistants across different levels, but also across all disciplines. We've had students from public health, public affairs, sociology. We've also had students from human-computer interaction, super broad in terms of who we bring to the table. For our staff, we also engage other folks at the Institute as well as the university related to marketing and communications. And then just broader across the university, faculty experts are critical to our work, as I alluded to before. We're very multidisciplinary. We're not experts on every single topic in this space. And so it's important for us to have those experts on tap. Other existing research centers and groups like the Community Engaged Research Group, which I'll talk about a little later. So I alluded to first evaluating solutions, and this is primarily through working with a variety of different projects that are funded by external partners. And so I'll talk a little bit about this later because I think our perspective as people who are community engaged and care about outcomes and partnerships and relationships is that we want to be as relevant as possible, but we also don't want people to feel like they have to pay us. As I alluded to before, we're a soft money organization, so any support we get is great, but we also feel like it could be a little predatory and it doesn't distinguish us from being a consulting firm or other things. So we always want to make sure that we are first centering the folks that they serve by addressing a hyper local problem when we can. This could be news assessments, program evaluations, whatever is necessary, but something that, somebody else might not be able to come in and do justice because they don't understand the nuances of the community that they're serving. And again, they might apply for federal or local grants, they need a partner or they want a partner, or we've even had other folks say, in order to get this funding, you need to work with CRISP, or we recommend that so that you can make sure that your work is valid. And so having those relationships is critical in terms of how we evaluate them and what we're evaluating. I want to highlight a few projects that we have currently that kind of intersect with racial equity and social policy so you can get a bit of a feel for what we do. So we have a current project with Indianapolis Public Schools that assesses police department practices and policies, and it also includes an analysis of what those activities are relevant to student disciplinary outcomes. So we'll get to do, again, a really cool mixed method study that assesses what those practices are, what those policies are, and then marrying those with what's happening at the school level with student outcomes. So it's going to be pretty cool and pretty impactful as they are trying to address their own policies and practices in light of racial and social equity considerations. This is a federal grant, the Innovative Reentry Initiatives. It's an example of how a partner might reach out to us in this way. So they got a federal grant and they're working with us and our colleagues at the Center for Health and Justice Research to do an RCT of wraparound services of a reentry program. So maximizing our skills in the social issues of housing, mental health, other social supports with theirs of more hardcore criminal justice systems and structures. Similarly, this is a really cool project too. I think they're all great, so that's not very descriptive. Evaluating how our local systems contribute to inequitable outcomes for Black residents. And so in this case, there's a local funder who is really interested, and it will inform their entire strategy of funding about where the gaps are in our system, our criminal justice system, to figure out where the gaps are and what organizations should be addressing those issues. And lastly, another example of a federally funded project is a multi-year assessment of wraparound services for families and students on financial and academic outcomes. So we're doing that project, that federally funded project, across multiple organizations that happen to receive that funding. And so again, social issues with equity related concerns in that work. A lot of people often ask us, so why does this matter and what did you get out of this? One of my favorites is, what kind of policies did you change? And I always push back and say it takes a very long time to see concerted change on policy outcomes. But I think there have been several projects that have led to some meaningful and visible changes. One is being able to influence local eviction related decisions and processes with a couple of community partners. We did a lot of in-depth community engaged work for about a year before the eviction crisis was highlighted, before a lot of housing things were highlighted, especially with COVID. We were doing this several years ago and really getting a feel for like, oh, this eviction stuff is really gonna get really big very quickly. And so not only did we release some local research and policy briefs on those topics, one of my favorite moments was at one of the townships or areas in our city that handles evictions and court cases. The judge actually held up a copy of our research brief and said, we have a problem here and we need to address it. And they immediately started talking about how they were contributing to the problem. That was pretty impactful for all of us. A local community center working with us to another year-long project, working consistently and pretty much living at that community center, working with a lot of kids. They were all Black youth in the neighborhood, and trying to figure out what crime prevention strategies look like. And what we found was that a lot of those kids in that particular neighborhood were really dealing with a lot of longer term trauma related issues. And so the director immediately pivoted to getting funding. And for the past several years now, they've had an on-staff counselor to be able to better address those issues. That's also benefiting their well-being. It's also led to a lot of funding opportunities for that organization. And then another final example, which is being able to be on call for training staff and other community leaders about neighborhood trends. And I think that always helps provide levels of support for just being on call and not just necessarily needing to have this majorly funded project, but just doing the work as they've asked us and being able to provide that in real time. As it relates to developing knowledge, we also have a lot of original research at CRISP, usually in the form of policy briefs, reports, and sometimes peer-reviewed work. Our goals in developing information is to make our language as simple as possible and to use as much equitable and accessible language as possible. We believe in both an academic review process, so circulating our reports among peers, but then also giving it to lay audiences and experts in the community. So we have a project where we've reached out to a former county clerk to get her perspectives on whether this really adequately represents what we're doing or what we found and what they're experiencing. Again, we really value timely issues for our community that's driven by residents' needs and interests and not our own. So there are tons of things that we think are cool and can definitely do, but if it doesn't really align with what folks are experiencing, what organizations are observing, we know that it's not going to be utilized maybe as well as it could. Unfortunately, we have the least amount of time to do original research. We don't get a lot of financial support to do this work, but it usually yields the greatest payoff for our team in terms of visibility and utilization. Some examples of work we've done in the past include evictions and housing instability locally, immigrant barriers during COVID-19, and accessibility related concerns, and even root causes of crime in a neighborhood in Indianapolis that has incredibly and consistently high crime rates. And so it spans, we try to hit maybe 6 a year, but we can go certainly more than that or less depending on our capacity at a given time. So as an example of some work that we're doing, this one coming up is about local poverty assistance. There are a lot of folks who are in need of financial support but can't always access it. And so our goal in that work is to examine different expenditures, administrative burdens in those processes to understand better how to serve lower income residents. And so it involves policy analysis, interviews, and analysis of expenditures in these areas. And so again, multi-method. We're working with community residents and agencies, and it has implications for all kinds of things, including what it means for areas that serve high proportions of people of color that might not be equitably able to access these supports. Housing code violations and evictions. This is a project that's using a spatial analysis, policy analysis, interviews, et cetera, to understand the code violation process and how that can exacerbate people's experiences in Indianapolis. And again, we are one of the higher rated cities in the US for having issues related to evictions and housing. I also want to talk a little bit about how these experiences have influenced peer-reviewed work for those of you who are interested in that. So our experiences working with a lot of nonprofits and their need to collaborate with one another, both for funding as well as just to actually execute their work, led us to develop a framework that talks about how different types of collaborations can actually exacerbate inequities in their process, in their outcomes. So that is something that's in review now that is a direct result of our multi-year projects related with working with nonprofit organizations. We also have work related to eviction outcomes. Again, this was inspired by one of my students who was a co-author in this paper about doing all the work and the analysis related to evictions over time and being able to look at this across the country and see if similar phenomena existed across the US that we were seeing locally. And essentially what we found is that in states that have really landlord-friendly policies, those areas tend to have higher eviction rates, and especially for communities of color. And so it's something that we saw pretty consistently. We've also gotten funding from the university to develop racial equity and assessment to figure out how organizations, and particularly government organizations, are equitably serving communities. And so we're in the process of developing that. So that is kind of what we do. And so now it's how do we share that? And I mentioned before, we primarily work with sharing these findings with media outlets, doing community presentations and even newsletters, as well as along with blog posts and other types of things. So in 2019, this is the number of media engagements for the entire Public Policy Institute. In 2018, we didn't have any, but in 2019, which is when we were officially on board, you can see that the percent change in the previous year went up quite a bit. But importantly, for CRISP, we had 108 individual mentions in the press based on our research, based on other activities. And so that to us suggested that our work in trying to make sure that outlets understood what we were doing was really making a difference. We also recall, because we were a new entity, we were starting from scratch. So we really didn't have a reputation. I allude to the fact that people weren't really pressed about inclusionary issues. And so we really had to build our audience, not just in terms of media audiences, but residents and agencies to let them know that we can be a resource for you. So on the left, you see a picture of some of the folks on our team doing some work at the state capitol at something called Day to Day, where we could share the types of work we were doing for state agencies and nonprofits so they could understand what we were doing. And also just doing things for fun, being available for services and brainstorming. We don't think everything should require a formal research question. We wanted folks to know, if you just want to email us directly about, what do eviction trends look like in my neighborhood, that we could help you do that, all the way up to, the mayor reaching out for different questions as well. So I think that for us helped lead to additional engagement in that way. I next wanted to talk about community engaged research as recruitment. I alluded to the multidisciplinary engagement that we have to do as a function of our work. This is a picture of our team in 2020. And the need for expertise, given the different topics that we do, it required us to, one, partner with faculty and staff. They benefit from working with us, certainly with funding opportunities, but because we can also be a conduit to direct community partnerships, either through us or partnerships that they have that they want to engage us with, or ongoing collaborative learning opportunities where we don't need a project. We just want to hear from you and make sure, does this make sense? Are we interpreting, the context of healthcare correctly? And so, it expands our opportunities to do more work, but it also gives them leverage to put on, especially if you're a tenure track faculty member, put on your CV and show that you're doing a certain type of work. Building off of that picture I just showed you, we also developed a specific process for identifying students. We had to figure out how to balance students who had an interest and passion for issues of social justice and actual skills that we needed to build our work. And so if you have both a high interest in this work and the skills to do it, we will pay you $13 to $17 an hour to do that as a research assistant. If you're still kind of in the passion phase, but don't really have the skills, we'll give you like a scholarship or an internship to kind of learn and figure that out. And then if you have a lot of skills but maybe not as much interest, we might have you in a similar situation where you can kind of analyze some data for us or do some interviews for us, but maybe you're not as interested in the work. So it's an opportunity for everyone to kind of learn different skills and also contribute to the work meaningfully. And we partner with lots of different units on campus to find and integrate students into our work. We were also inspired to develop a CRISP evaluation clinic. As I alluded to, we're a fee-for-service entity, and it just, I think, created a lot of gaps in our work, and especially our community engaged research, which doesn't usually pay. And we just think there are trade-offs. We hated telling organizations no, especially if they were doing really meaningful work in community, and we wanted to reward that and not say, well, we don't have the capacity to do your free survey that you need. We really wanted to honor the work of people who are doing things to help others. And so this isn't funded, not a lot of staff or student availability. And so we decided to provide pro bono evaluation services, primarily for nonprofits, but anyone else who meets criteria, if they address issues of equity and social policy and serve diverse populations, in addition to a variety of other criteria. And so in spring 2020, we piloted the clinic. The premise is that students partner with community organizations who we select from a competitive application pool. We select students from a similarly competitive pool, and we match them to address a straightforward research or evaluation problem as a team. The formal clinic is launching this semester, so it's starting right now. And we've also created a system where students can get do this as credit. And this is kind of beyond, we do have capstone courses and other things, but not one that specifically emphasizes the role of social equity and racial equity in particular in community, and equipping students with the language to address those things. And so we have a semester-long curriculum, including these different topics here. So you'll see, in addition to kind of traditional research methods, this is all intended to, if you don't come in with any skills, you should be able to walk away with how you can directly work with a community organization and inform them on these things. And so we think it's important for students to know how to write for lay audiences, to communicate for lay audiences, to understand the root causes of policy and institutions in perpetuating these issues, and also how to work with vulnerable populations in addition to just having traditional research skills. And so lastly, I wanted to wrap up by talking about community engaged research as research. And yes, research is in the name, but I think it's a little more complex than that. First, I think for me, doing community engaged research is particularly critical because the conversation of what research is changes outside of the academy. And that matters because what community organizations think research is very different from what a traditional researcher, especially a tenure track researcher, might consider research to be. And when we think about residents in particular, it can look very different. And so I think one thing that kind of shouldn't have surprised me, but I think was reassuring is that, they're not interested in multi-level modeling or, all these different crazy approaches. If you literally show, a map of here's what's going on in your neighborhood, and there are lots of people who do that type of work in, across all kinds of institutions, is that, in this case, it's being able to interpret it for folks as well, in addition to just like having the tool. And I think that kind of information is so crucial for people who might not ordinarily be as interested in engaging this type of work. And so being flexible and understanding that everyone doesn't view research the way the academy does, and that it really does actually matter and is often more impactful. Descriptive stuff goes way further than things that might be more complex. Second, that there's increased engagement in this space by national research. So I know RWJF, the Robert Wood Johnson Foundation, many other federal funders, a lot of these applications now are asking about how are you planning to disseminate this to the community? How are you going to translate this into something that's like not just peer reviewed, but could be, perceived and received by a lot of different entities. And so this is, I think, the direction of where traditional academic research is going, frankly, is being able to, if you can get the practice of learning how to talk and engage with lay audiences, that is going to be the next step. Another key issue is broadening a notion of who is a peer. In order to consider community engaged research as research. At IUPUI, we have a group called the Community Engaged Research Group that intentionally engages neighborhoods, university partners, et cetera, to really make a difference and do this work in a multidisciplinary, collaborative way. And so again, centering equity, social justice, and other things in addition to actually doing the work. And so not only do we view our academic peers as peers, but our community partners as peers. And that also takes us much further than just limiting it to what an academic notion of peer review or engagement is. Also, it's important to think about what it means to tackle emergent problems, especially in the social sciences. I think with COVID-19, there was just like a proliferation of all kinds of research. And, what it told us, I think, is the need that we have for ongoing and effective capture of what's on the ground, as I alluded to in my first slide, thinking about the racial justice protests. And so now what we're seeing, especially in the social sciences, is, okay, like, how do you do this and identify what the issue is before it becomes out of hand? And I think that is related to the need for rapid uptake, and especially in social science research now, is that it's not just about identifying the problem, which I think a lot of folks have done, but what do we do about it? And that requires a ton of community engagement partnerships to really understand what that looks like in practice. Personally, as Sherry alluded to, I just started a new role with the state of Indiana, which was both an easy and a difficult decision for me to leave behind something that I laid the groundwork for 5+ years. But then also understanding this work will be about using research, using evaluation to design racially equitable policy, which is what I thought my career was building to, but also that the work of CRISP set me up to do. And so CRISP still exists. I have some information at the end of this presentation about that, but I am just not the leader anymore, but the work continues. All the projects I talked about are continuing. And so that work is going to go on and be community engaged, but I hope to also implement these community engagement techniques in my work as now a state level bureaucrat. So just to wrap up with these critical reflections I alluded to before, first, that community engaged research is protest. It challenges the status quo, and especially in academia. Two, that community engaged research is a community resource. It brings research to the people and vice versa. Community engaged research, if you do it well, can be an ongoing well of information for everyone. Third, that it can be a recruitment tool for students, faculty, staff, and partners on interest and ability to impact others in a particular space. And then lastly, community engaged research, even though it has gotten knocked in the past for not being robust research, it is research. And it plays a critical role in increasing the relevance and visibility, especially in the social sciences, of why voice from the community matters and how it can be maximized for greater policy and community change. And so with that, I will open it up to Q&A. My information is here, but I've also included our director of evaluation at CRISP in case you'd like to reach out to her about any current projects. And so with that, I'll turn it back over to Sherry and start the Q&A.
Thank you so much, Dr. Mary. That was really engaging. I learned so much. My understanding of community engaged research was quite narrow, and now you've expanded my horizons on that. So thank you. So yes, there are some Q&A. There's some questions in the Q&A right now. If you want to start curating and answering, please go right ahead. Thank you.
Yes, thank you. So the first question is about how have you worked with private donors and what fundraising advice do you have for faculty who are working on important issues related to racial and social equity? Great question. I think the private space is definitely where a lot of the bang for your buck is right now in terms of funding, because a lot of foundations are trying to do it and they don't really even know who to fund or why to fund them. I would recommend working, if you work at a university or in a department that has, most of them have like a development office or someplace where you're doing fundraising, that is where I would start, because they definitely have greater resources to address those things, I think, in some cases, and can react a lot more quickly than the federal agencies might be able to. Catherine, did you want to jump in here?
No, sorry, I was just trying to unmute or help you with the questions. Go ahead.
Love
Please.
Zoom. This is great. So I hope that's helpful. I think it's about being able to state a clear case also for why your research is relevant and relevant to a lay audience, again, because it might be really cool and technical in your particular field of interest, but if you can't communicate that to a funder, and especially a private funder, they're going to be less likely to do that. But they usually have a process in place, and I'd recommend talking with folks who are in your development office in your school or at your university who can probably help you navigate that process a lot easier, because it's not necessarily something you can publicly apply for all the time. So I hope that is a helpful response. And I'll add that we also have, in Indianapolis, we have tons of, agencies headquartered. There's like Anthem, Blue Cross Blue Shield, the Lilly Endowment, which is also funding a lot of COVID vaccination things. So we have tons of foundations there. So we have worked with them quite a bit, and their process is a little different. So we'll recommend talking with someone on campus about that. Next question is, how has COVID affected the community-centric activities? Oh boy, it has affected it quite a bit. We work a lot with a lot of low-income populations, so they don't always have Zoom. If they do, they don't have great internet access. We were all talking before this call about how we don't always have great access ourselves, and so that's definitely been an issue. One thing that we've done is really collaborating with community partners as much as possible, because they have the natural relationships with folks. So if they are, working with clients over the phone and that's worked for them, then they will let us know, you can get in touch with this person via phone and that works for them. We've had to mail out gift cards if they participate with us, which is a little more costly than just, giving it to them in person if we were doing like an in-person focus group. We definitely aren't in a position to kind of physically sit around courtrooms and other meetings. And so, Zoom is fine, but I think there is an element of something missing when you can't kind of go in person and pick up on different nuances of, how people are interacting. So it definitely has affected what we do. I don't think it has counted us out, but I think there is just something missing with being able to just interact with folks in person. But we've tried to adapt, and we've adapted a lot of our, not letting students go out. We pretty much have shut down. We don't want anyone to kind of be at risk of, getting COVID or having to wear a mask. So pretty much everything we do is virtual, and it is not the same, but we're persevering. So good question. We're not friends with COVID for a lot of reasons, and that is definitely one of them. Let's see. Another question is, how did you build your audiences and who are they? And I think that's kind of a complex question, because we have, I think I would say in terms of a traditional audience that we're definitely not a traditional research center in the sense that our goal is to produce peer-reviewed research and pump out grants. And so for that reason, usually peer-reviewed research is kind of at the bottom, kind of our academic peers are at the bottom, but we still tend to engage with them anyway. So the American Society for Public Administration, they have a social justice section that we interact with quite a bit. We did some blogging with them. And so that's important, but primarily it's about building our audiences in terms of organizations and agencies, because we find that that is usually the easiest way to get to residents, is if they are working with, a local community center, then we can not just reach residents, but also reach the leadership. And because the leadership is invested and interested, then they will naturally find other ways for us to partner together and listen to and promote our work. And so that's really kind of the goal. Is we work with a lot of nonprofits and government agencies to try and bring them in, bring them on board. And that's definitely been a learning process. We've also done a lot of work in kind of whittling out how we prioritize, how we work with certain organizations. And essentially, if they don't really value, we work with folks who don't really care about research. So we're trying not to work with those types of folks anymore. People who don't value racial and social equity, we don't really work with them anymore. Even if the project isn't about that, it's so integral to what we do that if we find that there are weird misgivings about that, we try not to do that. So we really try to stay core to the people who care about what we do, with the idea that we think it'll just build on from there. So those are our primary audiences, if that helps. Another question is, can you discuss the relationship of the center to other parts of the university? For example, the social science departments, other research units, university leadership, et cetera. Who does the center report to? So the center reports, we have a few levels of reporting. The center is part of the Indiana University Public Policy Institute. The Policy Institute is a part of the School of Public and Environmental Affairs, which is a little confusing because that school is actually the top ranked public affairs program in the country. However, we have two campuses. So we have one in Bloomington and one in Indianapolis. So the Indianapolis one is actually where a lot of our administrative activities are housed because we're physically there. That's where our partnerships are, that's where the action is. And so we report to both Indianapolis as well as to the Bloomington campus. Besides that, because it is a school-based center, we don't actually have to report to higher levels because presumably the dean is handling that. At the same time, we definitely work with other research units, especially our, for both campuses, their respective vice president or vice chancellor for research offices. They've been super supportive. And of course, over the summer, have really increased their interest in racial equity related research. And so they've always been great partners and supportive of the work. We also work really well with other levels of the university, higher up into the university. So like, undergraduate education. I alluded to different academic units, particularly for recruiting students, has been great. So there are very few places that we're not touching because our work kind of necessitates that. And so that's kind of how we work. There's nothing super formal. We just try to make ourselves available. And the fact that we do this type of work means that more units reach out to us to do that. Another great partner is the media and comms folks for the university, because they're always in a place of trying to promote not just our research, but any type of media engagements as well. And so we've kind of, I think, done a good job of trying to be ubiquitous and integrated into so many different parts of the campus that, we have tons of great partnerships, and mostly just report though to our school. Another comment talks about personal experiences of regional racism, and having grown up in DC, moving to Michigan, understanding better what components of racism were the same and what were regional. Curious to know your thoughts about the national and regional efforts to raise awareness for and change attitudes and policies and ways in which the efforts need to be more granular. I would say a lot of the work that I'm trying to do in my new role is to really separate that, because I think you might raise a great point about there's a lot of work around implicit bias and what you do there. And that's important. But as a policy person, my job is not necessarily to change hearts and minds and attitudes of individuals. It's about recognizing there are going to be some people that are going to struggle in that space. And how do we either build them up and train them to do better, or recognize they can't really be helped? And how do we keep them from creating as much damage as possible? At the same time, those folks implement those policies, right? So you could be somebody who has a lot of bias, but even if a policy is equitable, you could be on the front lines, actively discriminating against people. And so I think that's kind of the difference, is that you have to raise awareness, like you said, and change attitudes. I don't think that's my role. I think there are people who are trained to do that work, and that we can work collaboratively to change folks while we're also trying to figure out where our gaps are in policy and legislation and how to kind of close those gaps. So I think, again, related, but can technically work in parallel, like you said, and not necessarily needing everything to be perfect to move or advance one or both things. So it's a great question. Someone else asked about being part of a research question, doing survey research in the transgender community. They've involved the community, the trans community, in the research life cycle. And the question is that some people on the research team are hesitant to make de-identified data available to other researchers because the data belongs to the community. Have you experienced this, or do you have any suggestions? Yes. Real serious community engaged researchers are definitely going to be on the line of like, the data belongs to the community. I do think there are definitely limits about de-identified data, and especially if you've built trust with the community to share that, to not share that information. I think you should definitely respect the wishes of the community in that space. If you have opportunities though to publish it, especially if it's in a non-identifiable way, that's great. I think also the trans community, there are lots of reasons for why they would not want that information released, especially locally. So yeah, I think it's important to revisit exactly not just the fact that they would not want it released, not necessarily that it belongs to the community, but why folks in the trans community would not want that information released, and having a more in-depth understanding of that should help kind of drive, I think, your decisions in what to do. Someone talks about that they created an organization for community engaged researchers, but having trouble shepherding users. Any advice on spreading the word with academics and communities? Unfortunately, I think with academics, some of this is kind of, as I alluded to, trial by fire and figuring out this is what you want to do. I think another part of it is people just not being trained from early in their academic experiences to be normalized that this is a cool and actually very pragmatic thing to do. So I would probably start with, like, if you can start early on with people who are in master's programs or doctoral programs, then that could be a way to partner with units to maybe get them more engaged. And then while at the same time, I think there are faculty who are interested in this, but are so afraid of kind of the trade-offs, especially for tenure versus doing this instead of seeing it as part and parcel, that you might have to do like some one-on-one digging, finding folks who might do stuff adjacent to what you're doing and kind of luring them in. And I would definitely do like some one-on-one type stuff, because that's going to get people a lot more engaged in what you're interested in and what your needs are, than kind of doing like a blast for folks who may or may not hear. I had a couple more questions, but I see Sherry has popped up and she's probably going to kick me off. So
yes, Dr. Merritt, would you like to take one more question and then we'll wrap up?
Yes, thank you. Oh boy, there's actually like 3 questions. So one is about narrating the need around racial and social equity about longitudinal versus current data. Another is about peer-reviewed publication outlets. And another is about placing value in academic publications coming out of collaborations. I would say community partners kind of don't care about academic publications, but they care. If you tell them that's the case, that's great, but they it's not a bad thing. It's just, I think they like to be like, oh yeah, we have a publication depending on the partner. But for other cases, like, no, I mean, just whatever report or brief you give them is enough. Peer review publication outlets, there are some, including at the University of Michigan, that specialize in community engaged research, but I think a lot of that is about framing your project in a way that's not just community engaged, but just answering a really important question. There is kind of a skill for how you go in between kind of code switching for a community audience versus an academic audience. And then lastly, this question around narrating the need for support around longitudinal data. I think increasingly, unfortunately, the discussions around COVID inequities have really driven a lot of that discussion. I would say that in order to make longer term change around systemic and institutional racism, that we need the data to be able to tell the story. And we're talking about policy change in particular. You're not going to see those changes for, a decade. So if you don't have longitudinal data, you will not have enough information to effectively see how change might occur. So that was my rapid fire attempt at trying to get the last few questions in. So thanks, Sherry.
Thank you so much, Dr. Merritt. This was fascinating presentation, and you gave us so much to think about here at ISR as we continue to produce social science research for the public good. And so much of what you said today resonates with us as we think about MLK's legacy and what we really need to do to translate all of our findings into changes to help society and continue in the footsteps that you are doing with CRISP and now in your new role. So we just wish you all the best, and I can't wait to see what you do in the space of health equity with the people of Indiana. They're so fortunate to have you leading that.
Thank you.
So thanks very much, and thanks everyone for watching today. As I said, we will send you out the link to Dr. Merritt's presentation. Bye.